heart disease, cancer, Alzheimer's, diabetes, arthritis, depression. These are 6 completely different diseases, and they all share one hidden root cause. Chronic inflammation, a slow, invisible fire burning inside your body, is now understood to be the underlying mechanism driving virtually every major disease of modern life. And the most alarming part, you cannot feel it. Chronic inflammation operates without pain, without symptoms, silently destroying tissue for years before disease appears. We go inside the inflamed body, organ by organ, to show you exactly what chronic inflammation does at the cellular and molecular level, and what you can do to stop it. This is chronic inflammation, and understanding it may be the single most important thing you ever learn about your own health. Inflammation is not your enemy. Acute inflammation is one of the most powerful and essential healing mechanisms your body possesses. When tissue is damaged or infected, resident mast cells immediately release histamine and prostaglandins, triggering the inflammatory cascade. Blood vessels dilate and become leaky, allowing plasma proteins and immune cells to flood into the damaged tissue. Neutrophils arrive first, engulfing and destroying pathogens through phagocytosis, releasing toxic chemicals that kill bacteria but also damage surrounding tissue. Macrophages arrive to clear the debris, and in healthy acute inflammation, resolution signals bring the process to an end within days. But what happens when this process never fully resolves? When the inflammatory signal keeps firing, day after day, year after year? This is chronic inflammation, and unlike its acute counterpart, it is not healing, it is destroying. Let us now go inside the organs that chronic inflammation destroys, starting with the most lethal target, your cardiovascular system. Atherosclerosis, the disease that causes most heart attacks, is not primarily a cholesterol problem. It is an inflammatory disease driven by the immune system. Inflammatory cytokines from the plaque weaken the fibrous cap, making it vulnerable to rupture, which is what causes a heart attack. Elevated C-reactive protein, a marker of systemic inflammation, is now recognized as a better predictor of heart attack risk than LDL cholesterol alone. Now to the brain, where chronic neuroinflammation is emerging as the central mechanism in Alzheimer's disease, Parkinson's disease, and depression. Microglia, the brain's resident immune cells, when chronically activated, release inflammatory molecules that damage the very neurons they are supposed to protect. In Alzheimer's disease, chronic neuroinflammation accelerates amyloid beta and tau accumulation, creating a vicious cycle of inflammation and neurodegeneration. The gut is now understood as one of the primary drivers of systemic inflammation throughout the entire body. When the intestinal barrier breaks down, a condition known as increased intestinal permeability or leaky gut, bacterial products enter the bloodstream and trigger systemic inflammation. Lipopolysaccharide from gut bacteria, circulating in the blood, activates toll-like receptor 4 on immune cells throughout the body, triggering low-grade systemic inflammation. In rheumatoid arthritis, one of the most common inflammatory diseases, the immune system attacks the joints directly, destroying cartilage and bone. Adipose tissue, body fat, is not metabolically inert. Excess fat tissue becomes a chronic inflammatory organ, releasing inflammatory cytokines called adipokines into the bloodstream. This adipose-derived inflammation directly impairs insulin signaling, explaining why obesity and type 2 diabetes are so closely linked to chronic inflammation. Chronic psychological stress dramatically amplifies inflammation through the same cortisol and sympathetic pathways we explored in our anxiety video. If chronic inflammation is so dangerous and so silent, how do doctors detect it? High-sensitivity C-reactive protein, CRP, is the most widely used marker of systemic inflammation. The liver produces CRP in response to IL-6 signaling from inflamed tissues. Interleukin-6, IL-6, is the master orchestrator of the acute phase response and a critical driver of chronic inflammation in metabolic disease and cancer. Fibrinogen, the clotting protein, also rises with inflammation, explaining why chronic inflammation increases blood clot risk and cardiovascular events. Homocysteine, an amino acid produced during protein metabolism, damages endothelial cells directly when elevated and is strongly associated with cardiovascular inflammation. The most powerful tools against chronic inflammation are not drugs. They are the daily choices you make about food, movement, sleep, and stress. The Mediterranean diet, rich in omega-3 fatty acids, polyphenols, and fiber, is the most extensively studied anti-inflammatory dietary pattern in the world. Omega-3 fatty acids directly suppress inflammatory cytokine production. EPA and DHA are converted to resolvins and protectins, molecules that actively resolve inflammation. Exercise is one of the most powerful anti-inflammatory interventions known. Each session reduces circulating inflammatory markers for 24 to 48 hours. Intermittent fasting activates autophagy, the cellular cleaning process, which removes damaged proteins and organelles that would otherwise trigger inflammatory responses. Sleep deprivation for even one night dramatically elevates NF-κB activity, the master inflammatory transcription factor in circulating immune cells. Curcumin, the active compound in turmeric, directly inhibits NF-κB, the master switch of inflammation, making it one of the most studied natural anti-inflammatory compounds. Chronic inflammation is not inevitable. It is the product of modern lifestyle choices, and it responds powerfully to the choices we make every single day. The fire can be extinguished, and understanding how may be the most important thing you ever do for your long-term health.